And you can write prescriptions. One of the questions we got was, can you refill my blood pressure medications? I mean, do you write prescriptions like everybody else at Boice-Willis?
Right. Now, and in particular for that question, that takes a little bit more discussion, right? Because if you have high blood pressure, you need to have a primary care physician who's following you for that and taking care of you for that over time. But stuff happens, right? I mean, I know there's going to be a time, it's a Friday afternoon and your doc's closed and you suddenly realize you only have 2 of your blood pressure pills left and you're going on a cruise to Alaska for 3 weeks.
Oops.
Of course, come on in. We'll help you out with that and tide you over. We have, as a matter of fact, last week there was a fella that is relatively new to Boice-Willis, had an appointment coming up, but realized that his blood pressure was in the 180 range. So he came in to see us, went ahead and got him started on some blood pressure medication, and then he has his next follow-up clinic with his primary care doc.
And that's often what you do, the service you provide. You kind of stabilize somebody and then get them to go to the appropriate person at Boice-Willis very quickly.
Absolutely.
The follow-up is key,
Yeah.
right? The communication that you give to every patient at the end of every visit in the walk-in clinic really does plug them in to a follow-up so that the care is continued.
Exactly. And for some things, you know, if you come in with a simple bladder infection and you're 20 years old, you need 5 days of antibiotics and you don't necessarily need follow-up on that, right? But on the other hand, if you come in with what you think's a cold and you're pretty wheezy, I can get you started on treatment, but I can also alert your family doc and say, hey, this person needs to be seen within the next couple of weeks for a follow-up to figure out what else is going on, if anything. And that has been the real advantage, is to be able to, inside the patient record, I can shoot a message over to the primary care doc and say, please take a look at this guy. And I know that they'll get him in. Or I can call and say, what's going on here? Do I need to know something else about this patient? So that communication is, as medicine gets more and more complex, that communication becomes more and more important.
We're so blessed to have this additional resource for
Aren't we
care.
though? I mean, because for 50,000 people that you must take care of, 50,000 beating hearts, you must see hundreds and hundreds of thousands of office visits every year outside of your walk-in clinic as scheduled appointments. And that's a tremendous amount of work and service that you have to the community. So it's inevitable that out of potentially 250,000 or more, I'm just guessing, of office visits, people get caught between cracks. You know, like the example you gave, and the service you provide to give people that safety net and get them, or people who just stray because they don't go to their family doctor like they should.
Yeah.
Right, and now they feel dizzy because their sugar's out of whack or something. That safety net is there for the non-compliant patient or just the average person who strays into non-compliance like myself. Right?
Don't we all?
Don, I'm sorry, I'll make the appointment.